The MK Mental Health Hour with Arthur Ellis Mental Health Support in partnership with Thomas Connolly Estate Agents and MKFM.
Just gone 7 o'clock on your Sunday evening. Hello, it's Leah with you for another Milton Keynes Mental Health Hour. Tonight we're talking all about self-care and we continue with MK's biggest hits, Booty Love on the way. And now here's the ones, Flawless on MKFM.
The MK Mental Health Hour in partnership with Thomas Connolly Estate Agents.
Absolute anthem from the ones. It's Flawless on MKFM. Good evening. It's Leah with you for another Milton Keynes Mental Health Hour. Tonight we're going to be talking all about self-care with pharmacist in the NHS, Sonal. And before we speak to Sonal and find out all about self-care, John, welcome back from Arthur Ellis Mental Health Support.
Hello, good evening.
Hello, lovely to have you with us as always. How have the last 7 days been?
Yeah, busy. Yeah, we're obviously it's coming to Christmas. So we are sorting out all of our Christmas do and everything like that. And we've been growing quite a bit. So we've been at the NCS graduation. I don't know. Of course. We went last week to speak with the mayor about the National Citizen Service, did a project for us. So the kids there were amazing and they raised enough for us to put two local children through a whole mentoring process. So that's like Brilliant. 8 to 12 sessions. Completely for free, so it's really good. We've been training, but also going into next year, we're going to be a team of 19 now.
Wow.
So
that's really grown a lot, hasn't it, in the last 12 months?
It's been a nuts few months. So it's been really good. So we've appointed some non-exec directors. We've got trainers coming on board, and our mentoring team is flourishing. So yeah, it's
fantastic.
It's been busy,
Congratulations
but it's really,
to you and
really
the
good.
team.
Yeah,
really,
good end to the year.
Definitely. Lots of celebrations for your Christmas party, I'm sure.
Yes, well, hopefully, yeah.
Yeah.
With self-care in mind, maybe not too many.
Well, that is what we're talking about this evening, all about self-care. Yes. Before we kind of delve into that, I would like to welcome Sonal, who is a pharmacist in the NHS and a self-care lead here in Milton Keynes. Welcome to the show, Sonal.
Thank you very much, Leah. Hi, everyone.
Thank you very much for joining us. So we're talking about self-care, and you are a self-care lead. What does that mean? What does your role entail?
It involves lots of different things, but essentially what we're trying to do is to try and support people to be able to build the knowledge and the skills and the confidence they need to look after themselves. Self-care can mean lots of different things to different people. Someone who's relatively healthy, it might be managing a bit of back pain when it flares up, or how you treat a cough and a cold when, especially at this time of year. But for somebody with a long-term condition, it's actually how do I manage my diabetes or my asthma? For somebody who's got issues with their mental health, then actually it's the steps that they take to be able to manage that.
And self-care can be really important in maintaining your mental health, can't it?
Yeah, hugely important. There's so many different things that you can do, I think, and it has an impact on your physical health as well. I think when you look after your mental health, then actually physically you stay healthier as well.
And it's a real case of not necessarily just we all do things that look after ourselves day to day, but it's having a conscious effort to build it into your routine and make sure that when you do come to a busy period or holidays come, you're actually remaining consistent with it, because then that's when colds crop in, or if you do have a mental health condition, when you might dip into a bit of a depression or your anxiety might get a little bit worse.
And actually in those really stressful periods, having self-care in place is actually probably the most important time to stick to it. And actually those are probably the times that it falls by the wayside, which is totally the wrong thing to be doing.
Definitely. So a bit of proactive planning, I think, is always useful if you know you've got a stressful period coming up, but also if you find yourself in one, it's taking time out to reflect as well.
Yeah. Absolutely. Well, there's a fantastic kind of simple ways to well-being. There's 5 simple ways that we're going to be running through after we hear from Booty Love. This is Boogie Tonight on MKFM. Booty Love and Boogie Tonight on MKFM. Good evening, it's Leah with you for another MK Mental Health Hour. Tonight we're talking about self-care with John from Arthur Ellis Mental Health Support and Sonal, who is a pharmacist in the NHS and self-care lead. Now, Sonal, we've just been hearing about what self-care means to different people, and it will mean different things to different people, and kind of been defining it. What is the reason that you kind of got involved?
Well, so early on in my career as a pharmacist, I sort of realised that the NHS has been a victim of its own success in a lot of ways. It's inadvertently robbed people of the knowledge and the skills that they need to be able to look after themselves in certain situations.
Right.
So, thinking about this time of year, we still have a lot of people going to the GP for coughs and colds and things like that, when actually you can get great advice from a pharmacist. There's plenty of medication that you can buy over the counter to treat yourself. There's really good information online these days. We still have a lot of people who have been diagnosed with long-term conditions, and they don't know, how they've ended up in that state. They don't really, they're not necessarily engaged in why they take their medication, and actually that can lead to further declines. So I'm really interested in how we can support people to develop those skills again.
And it's also when I suppose when you were dealing with people on a one-to-one basis, which you don't really do too much anymore, do you? Because you work on a wider scale across the whole of Milton Keynes.
Yeah, I'm not so much in a patient-facing role anymore.
Yeah, but you would have, I imagine, correct me if I'm wrong, that you would have seen things recurring or maybe getting worse with different people or different patients if they weren't practicing these sorts of things and building them into their day-to-day.
Definitely, and I think we're moving away in the NHS from telling people what to do to actually supporting them to find solutions to to their own sort of problems where we can. Obviously, it's really important to have those professionals available when they're absolutely needed. Part of self-care is knowing when to seek the right kind of help from professionals, alongside doing the things that you can do to look after yourself. But absolutely, I've seen people go into quite a decline because we've just not been able to support them in a timely fashion and in the right way.
And from my perspective, I've got a long-term condition, and if I don't, I know that if I do hit a stressful period or something, it's kind of a snowball, because self-care becomes more difficult to practice. And then because you're not practicing self-care, you get worse, so it becomes even harder. So it's a case of really encouraging people to just build it into their routine when they're well, when they're bad, or anything, so that they can do these simple little things for themselves that are going to keep on top of things.
Definitely. I think just being a bit conscious about it really helps.
Yeah.
And there are simple ways that people can do things to become better at their own self-care. Now, I feel awful because this is something that I hadn't actually heard of before we started kind of planning for this show. But it's called the 5 Ways to Wellbeing. Talk us through those, Sonal.
So there's five ways, and this is nationally recognised. There's a lot of evidence behind this, and I won't necessarily go into the detail now, but it's out there if people are interested in looking at it. But so there's 5 ways that we know are good for people's well-being. So the first one is give. So that can be around giving your words, your time, being there for a friend, doing some volunteering. The second one is connecting. So again, that's very much about your social connections. We know that isolation and loneliness have a massive impact on people's health and well-being. So actually keeping up those connections is really important. Be active. That's kind of an obvious one. I think we all know staying active is good for people's, it's good for their physical health, but actually it's good for your mental well-being as well.
Boost.
And actually, if people want to find out more about kind of fitness and the kind of relation it has to your mental health, we did do a show all surrounding fitness and mental health. So if you want to listen to that as a podcast, it's over on mkfm.com. So that's be active. Very, very important.
Yeah. The next one then is about keeping learning. So I think it's, I don't know about yourselves, but I know with me, I love to learn. I get really excited when I learn new things, and I want to share it with other people. So keep learning new skills, new activities, all of those sorts of things. It's really, really good for people's well-being. And then the last one is take notice. So that can be, taking notice of your surroundings. If you're going out in a lovely green space, it's taking
just
notice
being
of
present,
nature.
isn't it?
Yeah. But the other side, it's being present. It's noticing your own thoughts and your feelings, and actually, if you're a bit more mindful, then you can identify those times that maybe things are slipping a bit, and you might need to put something in place.
Yeah, it's like last week on our bullying show, we had feel your feelings as one. So it's actually, if you are angry, recognise that you're being angry. Or if you are sad, recognise it, and have tools and little things that you can do to get you out of those emotions.
Yeah.
I guess so, positive things rather than in our training with companies. We always see people who, if they are really angry about something or they're going through a rough time, their immediate thing will be, oh yeah, I'll just go on a what typically it's phrased as a session.
Right,
so we'll
yes.
just go get smashed and I'll be fine in the morning, but that doesn't necessarily help long term.
No.
So,
because you're not getting to the root of the issue.
Exactly.
Part of taking notice
Exactly.
is understanding why you're in that situation,
yeah,
I think.
so it's building these more helpful things in, so we're actually able to take control of our well-being consistently, rather than getting to a point where it's snowballing out of control.
Well, for us to kind of get a better understanding of those 5 ways to well-being, you had quite a stressful couple of months, didn't you, Sunal? And we're going to hear how you kind of implemented those 5 ways to well-being after we hear from Avril Lavigne. Complicated plays for you next.
The MK Mental Health Hour with Arthur Ellis Mental Health Support.
Haven't heard that for a little while. Avril Lavigne and Complicated on MKFM. This is the MK Mental Health Hour this evening, talking all about self-care with John from Arthur Ellis Mental Health Support and Sonal, a pharmacist in the NHS and self-care lead. Now, Sonal, we were just hearing about the 5 ways to well-being, which is give, connect, be active, learn and take notice, all things that we can do to kind of look after and do a bit of self-care ourselves. And we were saying, actually, it can be really tricky to actually implement that if you're going through a very stressful time. It's one of those things that self-care just kind of seems to go by the wayside, and actually it's the one time that you actually really need to do it and to use those things. Now, you had a very stressful week recently.
Oh, more than a week, actually.
Was it?
Yeah.
Was it a prolonged period of time?
It's been, yeah, it was a good couple of months where actually things got very, very busy at work. Not that I'm complaining, because I like to be busy, but actually, things got very busy at home as well. My back ended up playing up, so that put me out for a couple of weeks. And then on top of that, I was having problems with my car, which I'm pleased to say are resolved now.
It's one of those things, isn't it? When it rains, it absolutely pours. And I think there'll be lots of people that can relate to what you're saying.
It happens all the time for everyone, doesn't it? But you just don't know when you're going through something like that. You often are just trying to firefight everything that's going on, rather than taking a step back and looking at, okay, so what can I do for myself?
Definitely. And I sort of realised, I'm self-care lead, and I really let my own well-being slip during this time. So I can't just talk the talk. I've actually got to walk the walk now.
And did you do that during that time?
Yeah, I did. So actually, this it was just before Self-Care Week, which is a national awareness raising week that happens every November.
Right.
So it was just in the lead up to that, I suddenly realised that I was working so hard towards getting things off the ground for that week that actually I'd neglected myself in the run up to that. And I thought it'd be a really great opportunity during Self-Care Week if I can demonstrate to other people. I've been through a really, really tough time, and I'm now going to make a real effort to focus on myself during this week, and how best can I demonstrate it. And I thought, well, if I can get involved, 5 ways to well-being, if I can maybe get involved and undertake just one a day, then maybe that's a small little bit of focus that's going to help me get through the week and actually just get take those small steps to get back on top of things.
Absolutely. So how did you go about doing that? What was kind of the first step for you?
You had a great week, didn't you? It sounds really nice.
Yeah, I was sort of reflecting on the week, and I thought, if I can have more weeks like this, it would be really, really good, actually. So the first day, November, it can go either of 2 ways with the weather. It's either really dank and raining and foggy like we've had recently, or you can have lovely sunshine, crisp mornings. And it just so happened that Monday morning, start of Self-Care Week, was a lovely crisp morning, sunshine. All the, those golden red leaves were still on the trees. So I took myself out for a lunchtime walk. I'm really fortunate to live in a really beautiful part of Milton Keynes near a canal. So I went out for a walk. You could say, well, that was going to be active, but actually for me, it was taking notice. I was enjoying the sunshine, the wildlife, all the lovely colours on the trees, and just taking that little walk at lunchtime. It broke up my working day a little bit.
Not walking with your head in your phone.
No,
playing
actually,
Candy Crush or anything like that.
I got the phone out a couple of times just to take some photos, because I wanted to kind of record my week on social media as well. But yeah, otherwise it was just very much being in that moment.
So that was you kind of taking notice. So tick, well done. You're off to a very good start. Where did you go after that?
So the second day, as I mentioned, it had been a really stressful period, and my husband had been absolutely wonderful through all of that, being really, really supportive. And I thought, actually, it's time to give something back to him. So the plan was to cook him a lovely dinner. It was also International Men's Day that day as well. So I thought, hit two birds with one stone. So the plan was to go cook him a lovely dinner, say thank you. Actually, I forgot a key ingredient on the way back home from the supermarket.
It's not about that. It's the thought that counts.
It's the thought, and in the end, he was willing to accept a takeaway as a treat. So that's what we did. Yeah. So I treated him.
Was
to
it a really
takeaway.
main ingredient then?
What's that? It was a pretty significant ingredient.
That's all right. We still ate, so that's
yeah,
good.
exactly. We still ate. I paid for the takeaway. He enjoyed it.
Oh, lovely.
Yeah, so
and
it all
washed
worked
well,
out.
limited washing up and limited all that sort of stuff as well. So you don't, you've got less
Worked
things
out
to do.
perfectly.
Yeah,
So that's
yeah.
you giving.
Yes.
Then what happened after that, day 3?
So the day 3, this is actually a really interesting one, I think, because it demonstrates this, again, this wasn't just about me, it was about someone in my family as well and how I could support them. So I've got a young cousin who suffers from Crohn's disease. He's actually going in for surgery in a week's time, actually. Right. So he's 14 years old, and for anyone that doesn't know about Crohn's disease, it's quite a severe inflammatory disease of the bowels, and it can have quite severe consequences. But I wanted to learn more about how I can support him to be able to self-care. So actually, the Crohn's and Colitis Society, which is a national charity, they've come up with this app, which is Walk in My Shoes, or A Day in My Shoes. But the idea is it kind of you download this app, and it takes you through various things that somebody with Crohn's disease might experience during the day.
Oh, that's so good.
Urgency
From their
for the
perspective.
toilet, waking up in the middle of the night because you've got severe pain, all of those sorts of things, and by learning what he would, how his day might be impacted, that it allowed me to sort of have a more empathetic view about how we might be going through things, and actually how I could support him. That's a really important bit about self-care. It's not just what we do for ourselves, but it's how we support our loved ones as well.
Absolutely. So that was you kind of ticking off the learning part of your 5 ways to well-being.
Yeah.
Absolutely. And then next up was connecting.
Yeah, so connecting. So that was at an event we put on a workshop, and I had a chance to meet some old colleagues and some new colleagues, and it was all about how do we support local people and communities to improve their health and well-being, and actually how do agencies come together and work together to support local people. So it was really, really good to be able to connect with new people and old people, and actually take some of this stuff forward about, as a system, how we support people, because it's not just about individual actions, it is about organisations and services coming together as well.
I don't think people do that enough. Like, even though it's a work thing, you don't necessarily see it as a social.
No,
because you're not with your friends and stuff.
Exactly.
You're with colleagues, whereas colleagues can be friends. I know that, but you don't necessarily. It's the social interaction that's important around connecting, rather than it being in a particular setting.
Yeah,
It's
definitely.
just human on human. Talking, interacting, and all of that sort of stuff. So that's, I think people kind of disconnect those sometimes, which is looking at the opportunities in your workplace as well to make the most of that social interaction.
Absolutely, yeah. And I think, sometimes it's, if you notice that, and a colleague's not looks like they might not be in a great place, then it's about reaching out to them as well and connecting with them. Yeah.
And throughout that time of self-care, were you able to keep active as well?
So this is the one at this time of year that I struggle with the most. As the nights draw in, it gets cold. I'm naturally more active in the summer. I really struggle at this time of year. So last year I actually bought myself an exercise bike.
Oh wow.
So that was my way of, there's limited excuses then. It's it's in my house. It doesn't matter how cold it is, how wet it is. Nothing's going to stop me from getting on that bike. So that's my it does become a bit of a clothes horse in the summer, but in the winter it's really useful.
And it all made you feel a bit better doing all of those things as well.
Definitely. I think, as I said, I'd had a really stressful couple of months, and it was really, really good to actually force myself to kind of really think about it and build it into my day.
Definitely. Okay, well, we're going to look into this a little bit further and how you can build self-care into your routine after Daniel Bedingfield. This has Got to Get Through This on MKFM. Daniel Bedingfield, Got to Get Through This on MKFM. It's Leah with you for another MK Mental Health Hour. We're talking all about self-care. So, John, we were just hearing about Sonal's stressful week and how she's kind of put self-care in place and kind of how we can learn from that. But I suppose now it's quite important to see how we can build in self-care into our own routines.
Yeah. And Sonal's is a wonderful example where it's not even difficult things. I think sometimes when people say self-care, it sounds like it's a doctor-related thing or it's a clinical thing, but it's just a human thing that we all need to kind of build in. So building into your routine is really, really important. And it's some things that we as humans, I think, just don't consider. we just go through day-to-day life and don't look at these different ways that we can actually remain well. So having a look at building it in to your day-to-day is, I wouldn't even say it's important. It's an absolute necessity, really. But there are things that we're going to be doing day to day that fall into these categories. But it's about being conscious about it and knowing that if we are going to get, like we've done the Change in Seasons show, we've done a variety of other shows that address these issues. So if we know any issues are coming up, we can start planning ahead, building different things in. Because I don't know about you, or you guys, but me, I have some of these 5 ways that are relatively consistent. So my be active is go to the gym at 7 o'clock every night. Well, not every night. I don't want to say that.
Certain nights.
4 days a week or so. Yeah. So that's my consistent, because the weather doesn't really impact that too much because it's indoors. I know, Sonal, you had the exercise bike that you got to make sure that you did do it when
because be active is actually
rubbish.
the one I'm really inconsistent with in the winter. I find it really, really easy in the summer. It just comes naturally, but I have to give it an extra focus in the winter.
So there are some things that are going to be more consistent for sort of someone like me versus someone like you, Leah. So it's having a look at which ones are your consistent, and that could be your take notice for the day. Just having a look at mapping out what your self-care activities actually are, which ones you find really easy, which ones are a little bit more difficult, and starting to plan out what it is that you're able to do. So the main thing really that we were part of a group where we actually came up with a hashtag, because there's some people who may be a little bit isolated at the minute, who might not necessarily have any ideas around what they can do for their self-care. So we've helped, or we've been part of this movement to help hashtag 1 a day MK. So it's taking a look at all of these 5 ways, figuring out what your 5 ways are, and then sharing it with other people so they can get involved. Maybe someone in your local area doesn't necessarily know or have any ideas about what they can do to connect or what they can do to be active. So it's sharing what you're up to so other people can maybe get involved and do their own version of it.
Yeah, I think what we've realised in recent months, there's fantastic things going on all around Milton Keynes that people can get involved in. But just the nature of our city means that I think you don't always know the really, really local stuff going on within estates and communities. So it's a really good way of just sharing and promoting all the fantastic stuff that is going on as well.
There's so much stuff. So do a hashtag, a meaningful one, and let people know.
And actually, that's part of your 5 ways to well-being. It's giving, isn't it? And it's connecting.
Yeah,
it's actually ticking off a few of them.
Yeah.
So the hashtag again, John, is hashtag 1 a day MK, and it's for people to go and either get inspiration and see what they can do that's kind of going to help their self-care, or share what they are doing themselves.
Share what they do. Share something positive on social media and have it used for that purpose rather than anything else.
Fantastic. No, it's a very good idea. Very good idea. So the hashtag is 1 a day MK. Go and have a little look at that while we play your Shapeshifters Lolas Theme, which is on the way for you next.
The MK Mental Health Hour with Arthur Ellis Mental Health Support.
Big tune from Shapeshifters. It's Lola's Theme on MKFM. Good evening. It's Leah with you for another MK Mental Health Hour, joined by John from Arthur Ellis Mental Health Support and Sonal, who works as pharmacist in the NHS and self-care lead. So we've heard all about how we can kind of start building self-care into our own routines, but actually really interesting to hear now about how organisations can kind of work together and how they can kind of help to benefit their employees as well with self-care, John.
Yeah. So we come up against loads of organisations, obviously, with our training. So we typically build bespoke packages to help internally support people's mental health conditions or mental health issues with proper evidence-based strategic tools, strategies, and different ways in which they can actually practically do things for themselves. But part and parcel of that is that we come across loads of organisations in my role, but also in Sonal's role. You must see loads of companies, and it's just the 5 ways is a really good starting point for any organisation to start addressing the well-being of their workforce.
I think definitely, and you think, in terms of sort of the days that people take off sick and things like that, it's, there's benefits for organisations in supporting employee well-being, because actually you have a more productive workforce then.
Absolutely.
Massively. And it's the stats, and I'm not going to go massively into the stats, but in terms of mental health training or anything like that, or well-being training, it's usually got near enough makes no difference, like 1,000% return on investment.
Wow.
So if you can actually make these subtle changes, it has a massive impact on how engaged people are, how loyal people are, how people are just happy generally in their work, which I think that majority of the time, rather than money or pay slips or anything like that, it's actually the gratification that you get from working that is one of the main reasons people stay and work hard.
Absolutely.
So I know a lot of people, they go, you know, they love going to work because of the social aspect. It's, you know, they love their job and everything, but it's the social bit that they really enjoy.
Definitely.
So the working from home thing doesn't resonate with everyone.
No.
Yeah, and I think the most important part is that, yes, we can all take care of our own self-care by doing these simple steps, but at the same time, if people go to work and all of that's forgotten, then it's not going to remain consistent.
No.
As workplaces, as organisations, even as friends, like we go into school to talk about exam stress and stuff quite a bit. And if all of you're trying to work really hard, but if all of your friends are telling you something different and trying to pull you away from revision, they're not helping.
No.
So we need to be able to facilitate well-being as well in our communities and our organisations. So this is a really good place to start with that.
And there are some really simple things that kind of organisations can do. For example, telling somebody or encouraging people to go out for a walk at lunch and kind of putting those simple things in place.
Yeah, building it out, have walking meetings.
That's a great idea.
You know, you're in the air. Maybe, you know, like someone said, it goes one of two ways in November. But we're in December now, aren't we?
Yes.
Wow.
Yeah.
Okay. So it goes maybe one way in December. But just, walking meetings, just going out for a coffee instead of being cooped up in a boardroom. Having plants in your office as well is another really good one because it actually encourages circulation of air. I think that there is a stat that if you've been in a boardroom with no plants and no air circulation, the carbon dioxide levels are way too high after 2 hours to make any decisions.
Oh, that's interesting.
So anyone having a full boardroom day, those directors or those people in that meeting should not be making decisions after a couple of hours.
Definitely not.
If anyone wants to talk to us about that, then please give us a shout.
Well, some really interesting tips this evening. We're going to continue with a bit of a roundup. If you've missed any of the show this evening, a bit of a kind of a summary on its way after Usher and on MKFM. Usher and on MKFM. This is the MK Mental Health Hour tonight, talking all about self-care with John from Arthur Ellis Mental Health Support and Sonal, a pharmacist in the NHS and self-care lead. It's been a very informative show. As always, John, we've got a little summary for people if they've missed any elements of the show this evening. Yeah,
we do. And it's just a roundup just to say that take a look at all these five ways for yourself. Have a look at which ones that you're quite consistent with, that you're really good at and you've got things for. And those things that kind of vary based on the time of the year, any changes in your life that happen, and start planning ahead to make sure that you either whack something else in there so that you remain consistent with it. And then as organisations, start facilitating that. And if anyone needs any help with it, we have got the guide going out tomorrow morning. So that's going to be on our website, which is Arthur Ellis MHS for mentalhealthsupport.com. So you can download that and that will have Sonal's toolkit in there as well. So it's just one place with all the information, nice and simple. And then any companies that want to have us in to train in these practical tools and these plans, then we've got training programs that we're sorting out for next year now. So we've got every training day that we do as well. We're able to provide children with full sessions of emotional support. So we're looking to build this free, sustainable one-to-one service for children.
Fantastic. And I suppose the guide is obviously a great place to start, but also use the hashtag OneADayMK. Search for that online to get a bit of inspiration and also make sure that you're sharing your kind of self-care ways to well-being as well.
Let everyone know all the good stuff that you're doing.
Exactly. Now, you've got a busy kind of week next week and you're going to be at the Stadium MK, aren't you?
Yes, we're going to be at a Don's match. So we've got, we're descending, Arthur Ellis is descending to do some fundraising for the children that we're looking to support. So we're looking to build a free one-to-one service for children to provide emotional support with our mentors. So we're at the MK Dons Oxford United match. So we've got Donny and Mui as well holding buckets for us. So we're going to be there with a few people. So if you do see us, come say hello. And we're also going to be throwing out loads of flyers and all that sort of stuff as well.
Fantastic. And if people want to find out more details about Arthur Ellis Mental Health Support, again, what is your website, John?
Yes, it's arthurellismhs.com.
Fantastic. And we'll make sure all the details are over on our website as well, which is mkfm.com. Thank you both so much for a fantastic mental health hour. It's been really, really informative.
Thank you.
And
Thanks for having us.
And a reminder, if anybody did miss any of this interview, it will be podcast over on our website, mkfm.com. Next week, John, what are we talking about?
Domestic violence.
Okay.
It's quite a big one.
It's going to be a big one. So join us next Sunday from 7 o'clock for another mental health hour.
The MK Mental Health Hour, in partnership with Thomas Connolly Estate Agents.